Good evening. My name is Denise Baker, and I'm here to talk to you about an important topic this evening: patient noncompliance with medication. This is part of Module 6 assignment for psychopharmacology with Dr. Sadek. In part 1, we're going to talk about what medication noncompliance is. Medication noncompliance is when patients do not take their medication as prescribed by their physicians. You may know some people like this. I know from personal experience with friends and family that many people think they know better than their doctor how, when, and how much of a given medication they should take, regardless of what their physician has prescribed. Kirchheimer in 2014 reported that he found in a study in Great Britain revealed that 10 days after being prescribed a new medication, approximately 1 in 3 patients were not taking their medications as prescribed by their doctors. Even worse, 1 month later after being prescribed life-saving medication, 1 in 4 patients were taking the drugs incorrectly or not taking them at all. Apparently, half of the noncompliance was unintentional, often because the patient was forgetting to take their medications. But what is even more scary is that about half of the patients were intentionally not taking their prescribed medication because of concerns or beliefs that they had about the medication, which may or may not even have been true. So what are these reasons for noncompliance? There are many reasons why people are noncompliant with their doctor's orders for medications. Sadly, we can think of some people who just can't afford the medications their doctors prescribe. Obviously, if the prices are out of people's reach, then they will not be able to obtain the life-saving medication they so critically need. This is very sad indeed. Other reasons patients are not compliant are that they do not trust their doctors, or they don't trust the medication itself, or they think it's giving them bad side effects. However, the most frequently cited reason for patient noncompliance with medication is that they actually feel that their pharmacists and doctors did not give them enough information about the medication. I found that sort of surprising because usually we get several pages of information with our prescriptions, but we also don't consider that some people may have trouble reading this medication and understanding it or even seeing it. The elderly may not have good eyesight. So it's really critical that doctors and healthcare workers get this information out to patients so that they know what they need to know about their medications. The majority of the patients cited in the study reported by Kirchheimer felt that they did not receive enough information. So Kirchheimer recommends that patients be more proactive in approaching their physicians with questions about the medications they are prescribed and about contacting them later as questions arise that they may not think of. This is because studies are showing that physicians are not very good at following up with their patients to make sure how they are doing on their medication. Another problem which may lead to noncompliance is the fact that patients are often not organized enough to keep track of their medication schedules and doses. It's important that patients have a plan and a schedule. I've also found that it helps to keep prescription medications in a weekly pill organizer. You know, those kind that say Monday through Sunday on them. And when you put your medication in there, if you get distracted with a jar of medicine, this has happened to me, you know, then something distracts you, you set it down, and then you come back and you say, I don't remember if I took that or not. And one time it happened to me, and I actually took another blood pressure pill, and then I thought I probably took 2, and I ended up very sleepy and feeling kind of weird. So yeah, you do have to be careful with that, but when I have it in my pill organizer, if someone distracts me and I set it down, and then I come back, it will still either be in the pill organizer or I've taken it. So it's not really a question then. So I think that is really critical, especially with elderly patients and even the young. I know nowadays there's a lot of attention deficit people out here. So that is something I definitely recommend to all my patients, even if you only take 1 pill. because that's what happened to me with just one blood pressure medicine, and I got distracted. So I really do recommend those. And ever since I've been doing that, I haven't had any mistakes. And so I think that is really a good way to keep patients from being inadvertently non-compliant. The next session, we will explore the risks involved with non-compliance. There are many risks involved with patients not being compliant with their medications. According to Brown in 2021, one of the top concerns for most medical providers is whether or not their patients will be compliant with their medications as they prescribe them. And we all know that things can happen, so noncompliance, in fact, is a top medical risk factor, leading to poor health outcomes and possibly death. There are many mental and physical diseases for which medication noncompliance can be life-threatening. For example, for patients who have diabetes, non-compliance to their insulin could cause them to go into a diabetic coma or even die. And oftentimes when they're not compliant, they have to have surgery and have amputations of body parts because they haven't been compliant. Patients with mental health disorders such as depression might commit suicide or even crimes, violent crimes, if they are non-compliant with their medication. So it's very important as mental health providers that we make sure that we're getting the word out there how important these medications are. So some strategies you can use for addressing compliance with your clients or non-compliance. In order to help my mental health patients be more compliant, I would spend some time with them, making sure they understood as much as possible about their medication, even though some of that will probably take place over at the medical doctor's office, the psychiatrist. I would also, if I had the literature, take the time to go over, make sure they could read it and understand it. So I would definitely be willing to do that with them and make sure they understand as much as possible. I'd let them know that many medications for mental illness can take several weeks to kick in, sometimes 4 to 6 weeks before they even begin. You might notice the effect of the medications, that they begin working. So in addition, I would let them know that some initial side effects, they may get some side effects when first taking the medicines, that will go away with time. It's not necessarily permanent. Your body always has to adjust to things. So I'd caution them about stopping any mental health medication suddenly also, because this can definitely be a danger from stopping the medication suddenly. They could get very bad side effects. So I would caution them to see their doctor if they want to stop the medication, if they think they're better, that they do it gradually and have their doctor monitor them. And so you can see this is very important to go over with your clients that may be taking medications. Thank you.